Okay, so I said, okay, why don't we try this new method where we can place implants directly and try to immediately load them. Of course, we planned everything. We did the impressions, we did the wax up, and so the implants were placed. Okay. All right. So we aligned it as much as we can. As you can see, one of them was off, but no worries. We can always, with these one-piece implant, we can always align them with the diamond burr afterwards. Note that there was no flat open. Okay. This is her immediate denture. What we did was we used the immediate denture as a template for our restoration. Those were nice immediate dentures. They were done very well. Okay. So the so-called teeth, the denture space were within the realm of the implant, and we used the ProTemp 4 again as a temporization. You fill it up. You use the same material, same stuff, and 1.5 hours later she goes home with teeth, with 6 implants in place. Okay, that's how she looked like afterwards. The final occlusion. I think that this is something that ideally you want to have your patients going home with teeth rather than having dentures, because when they say that you are giving them implants, you place 6 or 7 or 8 implants, and they still go home with dentures, and then you promise them teeth after a couple of months later. I think they feel that there must be something better. Okay? So, after a couple of months later, we see the patient again. I'm so sorry about the picture there again. We did some blood records, and we then restored her teeth with 10 units on those 6 implants. Okay. Another one, another professor who came into our surgery unit in the UITM is a 47-year-old lady. She's a Latin professor, so you don't want to touch her too much. So basically, she's missing an upper molar. She's lost the tooth 4 years before, and there she is. She's looking apprehensive, doesn't believe me so much, So you don't want to do too much for her. In this case, what I found that when I did the flat tooth surgery again. Okay, you then place the implant, the one-piece implant, using the same protocol, rounded twist drill, up to 3.5. We use the alignment gauge to get the depth right, and then we place the implant. But what I found in this case that I could not get a stability of 35 Newton centimeter. That is the key to success. Yeah. Okay. So in this case, what we do is we don't put in a provision. Do not load this implant. Leave the stump behind. I mean, what could go wrong in this case? At the most, the implant fails, yeah? But when you put in the stump, you clear it out of occlusion and leave it as it is. Okay? In this case, we could not get that 35 Newton centimeter. We leave it as it is. And then later on, okay, that's alright. We leave it. That's the X-ray immediately after the implantation, and we leave it for about 4 months, as it is there, without any provision. And then after 4 months, we go in and we take the final impression, like your crown and bridge. We get the prosthodontist to do it, and then we got what she wants. Okay, so that's the tooth after 4 months. She goes home with teeth. Okay. Okay.